Hello and welcome. I'm Dr. Robert Singer, Director of Neurovascular Therapeutics in the section of Neurosurgery at Dartmouth-Hitchcock Medical Center. And on behalf of Dr. Cliff Eskey and our entire team, I want to welcome you to this module on cerebral aneurysms. It's our hope that the following information will be helpful to you in understanding your care. You'll have plenty of time to discuss questions during your virtual visit. What is a brain aneurysm? A brain aneurysm, or cerebral aneurysm, is a weak bulging spot on the wall of a brain artery, very much like a thin balloon or weak spot on an inner tube. There are three basic types of aneurysms: fusiform aneurysms, where the entire blood vessel wall is dilated and abnormal; saccular or berry aneurysms, which are most common, where there's an outpouching on the side of a blood vessel, usually at a branch point; and mycotic aneurysms. Mycotic aneurysms are usually associated with an infection. There are a variety of locations for cerebral aneurysms. Most occur at an area called the Circle of Willis, which is a large networking area of arteries at the base of the brain. Again, most saccular aneurysms occur at branch points of blood vessels. In this slide, you can see the majority of the aneurysms that we see and their incidence. Cerebral aneurysms account for 5% of all strokes. We believe that there are about 10 to 15 million Americans that have them. 20 to 30% of patients who are diagnosed with cerebral aneurysms have multiple aneurysms. There are approximately 30,000 ruptures per year, and the mortality rate or death rate from the rupture of an aneurysm is very high at 45%. There are certain risk factors that contribute to the formation of brain aneurysms. Some of them include smoking, high blood pressure, congenital abnormalities, a family history of brain aneurysms, age over 40, women compared to men have an increased incidence of aneurysms, other disorders such as Ehlers-Danlos, polycystic kidney disease, Marfan syndrome, and fibromuscular dysplasia. The presence of an AVM, or arteriovenous malformation, can contribute to aneurysm formation, as can cocaine use, infection, tumors, and head injury. Risk factors that contribute to the rupture of a brain aneurysm include smoking and high blood pressure or hypertension. Fortunately, both of these can usually be treated with medical management and personal decision. When deciding to treat a brain aneurysm, there are many factors to consider. Those include the risk of hemorrhage, which is oftentimes associated with the size and sometimes the location of the aneurysm. Age and health of the patient is important to consider when making a decision about an operation. A family history and family impact of brain aneurysms often is factored in when deciding to pursue treatment. Also, from a surgeon's perspective, those risks associated with the proposed treatment are taken into consideration. And most importantly, patient preference. This illustration demonstrates the clipping of an aneurysm. A clipping procedure is done by an open operation. A small clip is placed across the base of the aneurysm to exclude the aneurysm from the circulation. Most patients having a clipping of an aneurysm will be admitted to the hospital the morning of surgery. Surgery time is usually around 4 hours. Oftentimes an angiogram will be done during the operation. Patients are transferred to the special care unit postoperatively for observation. Most patients can expect to be in the hospital 3 to 5 days, and a follow-up clinic appointment in 2 weeks is usual and standard. Another option for treatment is endovascular coiling. In coiling, a catheter is placed into the aneurysm and small platinum coils are deployed into the sac. Sometimes we'll have to use a stent or a balloon to help bolster the aneurysm coils into the lesion. Patients who are having a coiling procedure can expect to be admitted the morning of surgery. Again, surgical time is usually around 4 hours. Patients are admitted to the special care unit postoperatively. Heparin as a blood thinner is used oftentimes overnight. Aspirin with or without Plavix is usually started on postoperative day number 1. Likewise, patients usually go home day number 1 with a follow-up clinic in 2 weeks. Coil check MRI scans are usually done at 6-month intervals for a long period of time in order to assure appropriate treatment with coil therapy. The risks in treating an aneurysm include bleeding, infection, loss of neurologic function due to damage of brain tissue, stroke, hydrocephalus or poor circulation of spinal fluid, and finally death. The overall risk profile of aneurysm surgery is dependent on the lesion and your surgeon. Our overall risk profile at Dartmouth is quite low and well within the accepted standards. Again, thank you for watching this video. We hope that it will help you in your understanding of cerebral aneurysms and prepare you for your live visit, which will begin shortly. Please feel free to watch other modules and contact us with any questions or feedback.